Some 2 million people in the northeast of England are facing even tougher restrictions following a sharp rise in the number of new cases of coronavirus. The Health Secretary, Matt Hancock, announced that mixing between households in any indoor setting, which people are currently advised to avoid, will be made illegal from Wednesday. The region has already been under restrictions for the past 10 days, covering a wide area which includes Newcastle, Northumberland, Gateshead, North Tyneside, South Tyneside, Sunderland and County Durham. And the new measures mean it would be unlawful, for example, for people to meet in places like pubs or restaurants without anyone outside their own household. That's the crucial condition. So for the latest, we can join our North of England correspondent, Fiona Trott, who's in Newcastle tonight.
That's right, yes. From Wednesday, you could be fined at least £100. It's tough for the people who live here, and it's tough for the local economy too. It was already struggling to try to adjust to the curfew. Over the past week, bars have had to close, and even today, one manager told us he's had to make people redundant. Enjoying a drink after work, and enjoying it while they can. From Wednesday, Jordan and his friend will be banned from having a beer together. For many in this city, it's hard to swallow.
I'm torn, I really am torn, because if we want to try and get some sort of as a nation, then fair enough. However, if this keeps going on for a longer period of time, a lot more people are going to suffer in the long run rather than the short run. But at the same time, it is hard, and I do understand that people do need that social aspect for people's mental health. For my own mental health, I do need that complete understanding.
Their lives are changing yet again. Here in Newcastle and in 6 other council areas, they were advised not to meet at venues outside the home. From Wednesday, it's banned.
We will introduce legal restrictions on indoor mixing between households in any setting. Mr. Speaker, we do not take these steps lightly, but we must take them, and take them now.
This city makes over £300 million a year from the nighttime economy. It was struggling to adjust to a curfew, and the council says today's announcement came without warning.
This announcement has been made without any notice whatsoever to either us as local authorities or to our local police. And that's deeply worrying when it comes to making sure that we're all working together here.
Financial support to help with enforcement is set to be announced by central government. People here say they will stick to the rules, but it's hard.
I think it's a bit contradictory. I think, I've literally been at work today and I've stood with every man and his dog at work, literally so close to them, and I can't go and stand in my dad's back garden. It kind of makes not that much sense to me.
People are dying, so if it's worth sacrificing a couple of nights in the pub, then I'm not really that fussed, to be honest.
This city is famous for its nightlife, but all that's been put on hold. The challenge now is to keep people safe and protect the local economy too. Fiona Trott, BBC News, Newcastle.
There needs to be an urgent review of the 10 p.m. closure times for restaurants and pubs. That's according to Greater Manchester's Mayor, Andy Burnham. He said the measure had led to people gathering in homes and that supermarkets were being packed to the rafters, selling drink, for example, once the bars had closed. Downing Street says the policy in England will be kept under review, as our health editor Hugh Pym reports.
Scenes like these in York on Saturday night have raised questions about the new 10 p.m. closing time for pubs, bars and restaurants. People gathered on the streets after they had to leave local venues. There were crowds too in other cities after the earlier closing time here in central London. And here in Liverpool. And there have been calls for the curfew to be reviewed after reports of people gathering in off licences to buy alcohol.
The big problem with it, as far as I'm concerned, is it creates an incentive for more social gatherings in the home. And what we're told by the experts is that that's the big reason, the big place where more transmission of the virus takes place.
But Downing Street said the measure struck the right balance between protecting the public and allowing pubs and restaurants to continue trading. There's also a debate on new measures required to combat the virus. Middlesbrough's not one of the communities covered by extra restrictions, but some feel they are now essential.
We're probably a day away from being certain, we will go to government and ask them for more restrictions. We want to limit, subject to more info, limit the ability of people to visit other people's homes.
3 more areas in Wales, Neath, Port Talbot, Torfaen and the Vale of Glamorgan, have this evening joined the list of those facing tougher rules. People can't meet other households anywhere indoors and aren't able to enter or leave the areas without good reason. There are several parts of the north of England now covered by restrictions. The highest case numbers, according to latest data, are in Burnley, with 270 per 100,000 population, Knowsley with 265, Liverpool with 252 and Newcastle with 246 per 100,000. London's highest infection rates are a lot lower, with Redbridge at 68 and Barking and Dagenham with 58 per 100,000. London councils have now been designated areas of concern on a watch list drawn up by public health officials. But some council leaders feel that the published infection numbers understate the true position. In the borough of Hammersmith and Fulham, they were running mobile pop-up testing centres, but these had to stop when the units were moved to other areas. Now the council's concerned there are rising numbers of undetected cases.
The government keeps saying there's enough testing for everybody. That isn't our experience here. People who want to get tests can't get online to book them. And as a result, we have people, I'm sure of it, walking around our borough and all parts of London who are carrying the virus and potentially a danger to other people, and we just don't know about it.
There are now calls from some local authorities in the capital for the government to impose the same restrictions already in place elsewhere in the country. Hugh Pym, BBC News.
Well, the Prime Minister has said for months that local strategies are the best way to deal with local outbreaks of coronavirus. But what is the latest evidence on how effective they are? Our medical editor Fergus Walsh has been examining how well the strategy has worked so far since the pandemic took hold.
At first glance, life may look back to normal in Leicester, but people here haven't been able to meet inside each other's homes since March, unless they're part of a support bubble. You can only see friends in outdoor cafes, parks or other public spaces. Leicester was the first place in the UK to introduce local restrictions at the end of June after a sharp rise in cases. They were tough. People were told to stay at home and only travel if it was vital. Non-essential shops were shut for around a month. Public health officials started going door to door doing testing. It worked. Cases fell by half in the coming weeks. And in early August, restaurants, pubs and hairdressers reopened about a month after the rest of England. And in early September, swimming pools and gyms reopened. But in the past few weeks, cases have started to rise sharply again. There was a small increase in hospital admissions in Leicester in June, but mostly the trend has been downward. Cases have stopped falling, but are still way below the peak in April.
Very concerned that things are going the wrong way and that those case numbers we definitely need to get back down. I think to some extent pleased at the moment that we're still not seeing that result in hospital admissions, but fearful that that's going to come. And I think that's the key bit for me, is how do we protect those that are most vulnerable to admissions.
Caerphilly was the first local authority in Wales to be placed under extra measures from the 8th of September. People can't enter or leave the county without a reasonable excuse and can't meet friends indoors. Early indications are the restrictions are working, with cases falling sharply. Across the UK, at least 16 million people are subject to extra restrictions. That's just under 1 in 4 of the total population. The UK restrictions are not yet as drastic as those taken in France's second city, Marseille. All restaurants and bars were ordered to close at the weekend, following a surge in cases and hospital admissions. Businesses say it's a catastrophe. The dilemma there and here is how to control COVID without wrecking the economy. Fergus Walsh, BBC News.
With me is Hugh Pym, our health editor. Some very big questions tonight, Hugh, in 2 areas. We're talking about a local strategy, such as in the northeast of England, and a question about whether that kind of thing could be imposed elsewhere. And then we're talking about more widespread strategies, such as the curfew on bars at 10 p.m, and whether that's actually working. Now, can you shed light on those for us?
Well, Hugh, there are many threads to this. There are the debates on local restrictions with these big moves in the northeast of England, barring any form of household contact in any indoor venue. That is now being looked at as a possibility for the northwest of England, with a particular focus on Merseyside. And as we've heard, you've got council leaders calling for more restrictions in their areas. I'm told with London, despite calls for intervention there, nothing probably will happen in the days ahead. The government at Westminster will look for more data. Then you've got the national issue of the curfew on pubs, bars and restaurants at 10 p.m, the scenes at the weekend of people gathering in crowds outside. The Mayor of Greater Manchester, Andy Burnham, now says he doesn't think that's working on its own. It needs a 9 p.m. bar on the sale of alcohol in off licences. The government, though, has said, certainly for England, that it won't be further reviewed. And of course, at Westminster, there's a debate about the extent to which the state should be intervening in people's lives. But wherever that debate goes, we've certainly seen today there are a lot more interventions and measures being put into place.
Hugh, once again, many thanks. Hugh Pym there, our health editor.